In this video, we are going to talk about everything about healthcare in the United States. So before starting, please like this video and subscribe to this channel for our future updates. The healthcare systems of 11 high-income nations were studied by the Commonwealth Fund in 2017. The United States healthcare system came in dead last in practically every category, making it the worst among developed countries' healthcare systems. The United States' low position could be due to rising healthcare expenses, declining quality of care, and an increasing number of uninsured Americans. These problems still afflict the U.S. healthcare system today, perhaps more so than ever before. Meritage Medical Network aims to make it easy for you to access a reliable source for healthcare information. That is why the team has compiled this manual. Do you want the actual facts about medical costs, quality, and more in the United States? You've arrived to the right location. Continue reading to learn more about the current condition of healthcare in the United States. Healthcare in the United States costs. The United States spends more than $10,000 per person each year on healthcare. This is more than double what advanced countries such as the United Kingdom, Australia, France, Canada, and New Zealand spend. Firms in the United States spend more per capita on healthcare premiums than employers in other nations. In the United States, private businesses spend $4,092 per capita, which is 5 times more than the runner-up, Canada. From 1980 to 2018, healthcare spending per capita increased by 290%. In 1980, Americans spent an average of $2,900 per individual. Adults in the United States now spend more than $11,000 per year on average. In 2019, the United States ranked number 1 for the largest percentage of GDP, 16.9%, spent on healthcare costs. That's over double the average for comparable sophisticated countries. In second place, Switzerland spends 4.7% less as a proportion of GDP. National spending. The Centers for Medicare and Medicaid Services forecasts that total national health spending will reach $6.2 trillion by 2028. This is up from $3.6 trillion in 2018, and it is expected to expand at a rate of 5.4% between 2019 and 2028. National healthcare spending is growing at a rate that is 1.1% faster than predicted GDP growth, 4.3%. At the same time, the proportion of the market spent on healthcare is expected to rise from 17.7% in 2018 to 19.7% in 2028. The burden of healthcare costs in America. In 2018, 40% of adults in the United States forewent a necessary test or treatment due to financial constraints. Furthermore, 30% of Americans think that if a surprise bill arrived, they would have to pick between essentials and paying a medical cost. At the same time, health insurance prices are increasing. In 2016, the national average premium increased to 30%, outpacing individual average income during the same year. The expanding predominance of high-deductible health plans could be to blame for the rising expense of health care, HDHP. In 2016, the average deductible was $3,069 per year. This is up from a national average of $1,975 just 6 years ago. Meanwhile, medical bills account for more than half of all bankruptcies in the United States. A sudden medical cost was the cause of 66.5% of bankruptcies in 2019. How healthy are Americans? Despite having one of the most expensive healthcare systems in the world, the United States has one of the lowest life expectancies in the industrialized world. In 2017, the average life expectancy was only 78.6 years. The Swiss are anticipated to live an average of 83.6 years, which is significantly less than the average for most advanced countries. In the United States, Black people had even shorter life expectancies. A non-Hispanic Black American's average life expectancy is 75.3 years. That's 3.5 years less than the national average for white people, 78.8 years. Infant mortality. The infant mortality rate in the United States was 5.8 deaths per 1,000 births in 2017. In 2017, there were about 22,000 baby fatalities. Oklahoma, Arkansas, Mississippi, Alabama, Georgia, and Tennessee were the states with the highest infant death rates. Infant mortality rates, like life expectancies, vary by racial and ethnic groups. Black newborns are more than twice as likely as Hispanic and non-Hispanic white babies to die during delivery. When compared to Asian Americans, Black newborns are nearly 4 times as likely to die during birth. Chronic conditions. We squander a lot of money in the United States paying for chronic diseases that can be avoided, such as diabetes and obesity. Cardiovascular disease. Lung problems. Chronic diseases and obesity are at an all-time high in the United States. America also has one of the highest rates of diabetes and hypertension-related hospitalizations in the world, second only to Germany. The importance of health insurance in the U.S. The United States has the third lowest rate of physician visits per capita among comparable countries. Americans only go to the doctor 4 times a year, which is half the rate of other developed countries like Germany, the Netherlands, and Australia. The United States also ranks first in the world for having the fewest practicing physicians per 1,000 people. With around 5 doctors per 1,000 population, Norway is in the top. Only half as many are available in the United States. A lack of demand for medical services is linked to doctor shortages and low rates of doctor visits in the United States. The United States has the second highest rate of out-of-pocket spending in the developed world, which contributes to a lack of demand. Switzerland is the most expensive, with an average of $2,069 paid. With $1,122 spent on out-of-pocket healthcare expenses per year, the United States is close behind. What happens when U.S. citizens are uninsured? The number of persons in the United States who are uninsured or underinsured contributes to the country's high out-of-pocket spending. The number of uninsured adults in the United States grew from 2016 to 2017 and again from 2017 to 2018. Uninsured people increased by 500,000 in 2018 compared to the previous year. Adults with low incomes make up the majority of the uninsured. Due to the high cost of insurance, people of color are more likely to be uninsured. These folks must choose between foregoing necessary care, 1 in 5 persons, or going into debt due to exorbitant medical expenditures. Perhaps this is why uninsured persons are more likely to acquire serious health problems. The majority of these health problems can be avoided with adequate medical care. What do you think about our video? Please let us know in the comments area below. If you enjoyed this video and would want to hear from me again, please subscribe and turn on the notification before leaving. Thank you for watching us.